Welcome to the pre-operative patient education for the Mary H. Hodges Joint Replacement Program at Cabell Huntington Hospital and Marshall Orthopedics. The Joint Replacement Program Manager's name is Shakara Pauly. Her office hours are Monday through Friday, 8 a.m. to 4:30 p.m. Her office phone number is 304-526-2607. Please note that she may be away from her desk for extended periods of time, so we do have a 24-hour answering service for you to call, which is available 7 days a week. That phone number is 304-691-1262. She can also be reached via email at shakaura.pauley@chhi.org. She's available both before and after surgery as a resource for you if you have any questions or concerns. You can also reach your surgeon's nurse during business hours at the main Marshall Orthopedics number, which is also 304-691-1262. This program will serve as your basic guide for before, during, and after your joint replacement surgery. All the information I review is located in the book you received titled Joint Replacement, A Guide for Patients and Their Families from the Mary H. Hodges Joint Replacement Center. The goals of this education include 1. To prevent complications and improve outcomes. It is well documented that patients who are educated about their risks and processes have fewer complications and better outcomes. Number 2. To review the perioperative processes and increase your understanding of what to expect. Not only what we're going to expect of you, but also what you can expect from us. 3. To identify common roadblocks or challenges and review ways to avoid those. And 4. To convey that having a joint replacement is a lifetime commitment. During this program, I'm going to review various phases of your surgery, including the preoperative phase, operative phase, postoperative phase, and rehab phase. I'm also going to review the potential complications and risks, complication prevention. I'm going to discuss your responsibilities as the patient, and I'm going to talk about shared decision making. Shared decision making. We encourage our patients to actively participate in care decisions regarding procedures, treatments, pain management, and discharge options. You will be given several do's and don'ts during the surgical process. It's important to follow your surgeon's recommendations and make good decisions regarding your health and well-being. Remember, you are responsible for the decisions that you make and their outcomes. Now, on to the preoperative phase. What's important to know before surgery? By this point, you and your surgeon have decided that surgery is the right option for you. Your surgeon will have discussed the type of surgery you'll be having, the risks and benefits, and implant types. The clinic will have given you a generalized education booklet about your type of surgery, and you will have received the information specific to your surgery date and specific preoperative appointments and education. You are required to complete a preoperative appointment with our perioperative team, specifically with Dr. Wallace. When you see Dr. Wallace, he'll review your medical history and complete a physical and other tests and screens. He'll discuss your pain management and discharge planning for after surgery, and you'll go through the pre-admission testing where labs will be drawn and an EKG completed. Before you see Dr. Wallace, please make sure you have completed this medical history form and bring it to your appointment. Ensure you list all allergies and medications, including herbal supplements and vitamins. When Dr. Wallace reviews this with you, he'll educate you on which medications you need to stop before surgery, noted here on the left-hand column, and which medications to take the morning of surgery, noted here in the right-hand column. When you go home, if any medications change from this list, please call our office right away, as changes may affect your treatment plan. Also, when you see Dr. Wallace, please make sure you review all current and previous medical conditions. Please alert him specifically if you've been diagnosed with rheumatoid or inflammatory arthritis, if you take long-term steroids by mouth, or if you have a pacemaker or implanted device. It is also very important that you notify him and all caregivers of any information that might help us care for you. Starting with your preoperative appointment, we'll ask you to fill out a survey. It's not a survey about us, it's actually a survey about you, your health, and your function. It's a short survey administered on an iPad, and if you have any questions or would like assistance completing the survey, please let Dr. Wallace or his nurse know, as they will be happy to help you complete this survey. Beginning in the preoperative phase, it's important that you begin managing your health. Keep in mind that our surgeons do not operate on patients who smoke. You must quit smoking before surgery. If you've been a recent smoker, during your pre-op appointment, a smoke assessment will be completed to ensure that your levels are low enough to safely proceed with surgery. Additionally, if you use illicit drugs or alcohol, please discuss this with Dr. Wallace, and he'll develop a plan with you and your primary care physician to safely stop use before surgery. It's also important that you maximize good nutrition by eating a healthy diet and maintaining good control of your blood sugars if diabetic. Please work with your primary care doctor to obtain an optimal weight. Many people ask if they need to donate blood before surgery. We do everything we can to minimize blood loss during your procedure. For example, your blood pressure is lowered during the operation to minimize bleeding. Blood vessels are cauterized, special medications are used, and we use the smallest incision possible. In general, for elective total hip and total knee replacement surgery, we would not recommend patients donate their own blood before surgery. The chance of requiring a blood transfusion for elective surgery, including joint replacement, is very low. If you have restrictions or questions about blood donation, please discuss this with your surgeon and your perioperative team before surgery. Another important aspect of managing your health before surgery is to stay active. It's very important that you're up, moving, and exercising even before surgery. Your surgeon will remove arthritis during surgery, but your muscles must be strong for therapy. In the back of your book are exercises you can do now to improve your mobility. Please take time to complete the following 3 times a day, 10 to 20 reps, though avoid any exercises that cause excessive discomfort. Ankle pumps. This exercise can help prevent circulation problems such as blood clots. Do this exercise by flexing your foot up and down. Next, quadricep sets. Tighten the muscles at the front of the thigh as you press your knee down towards the bed. Hold a few seconds and relax. Now, heel slides. Slide your heel towards your buttocks. Move it as far as you can comfortably. Hold a few seconds, then slide your heel back. Next, short arc knee extensions. Place a rolled blanket under your knee. Lift your foot, straighten the knee, hold, then slowly lower your knee. And finally, straight leg raises. Bend your non-operative leg, keeping your foot flat on the bed. Lift your operative leg while keeping your knee as straight as possible. Hold, then slowly lower your leg. It's also important to prepare your body before surgery. You'll want to have good dental health. If you have any current dental abscesses or infected teeth or gums, you'll need to make sure those are resolved before surgery. When you come in, you need to make sure you don't have dark nail polish on your fingers or toes, and no thick acrylic layers, though 1 layer of acrylic nails is okay if painted a light color. And it's also important that you don't shave your legs or groin for 2 weeks before surgery. This also includes chemical hair removal. Remember, no hair removal below your waist for 2 full weeks before surgery. When you go through pre-admission testing, they will give you special wipes and instructions on how to prepare your skin the night before surgery. It is very important that you use these as instructed to help reduce your risk of infection. Every patient is screened for MRSA, a type of infection which can colonize in your nasal passage. If your screen comes back positive, we will call you to add additional processes for decolonization. Please note that if your screen comes back positive for MRSA, this is not cause for panic. As long as you are not feeling ill or having any unusual sinus problems, the decolonization prep process just adds simple bathing and nasal ointment use. And to prepare your body, you'll want to make sure that you bathe regularly and apply clean clothes. Please sleep in a clean bed with clean linens right before and after surgery to reduce your risk of infection. Please limit having pets in bed with you, as their fur, dander, and claws can carry bacteria that increase your risk of infection. During this pre-op process, you'll also want to prepare your home by picking up any throw rugs that might cause a slip or fall risk. Please also create a clear path from your bedroom to your bathroom and up and down stairs. It's also a good idea to stock up on groceries and toiletries before your surgery. Also, in the time before surgery, you'll want to prepare your mind. Taking control of yourself is an important step to success. Make sure you know your medications and that you actively engage in your plan of treatment, because self-management leads to independence and improved outcomes. You also need to set goals for yourself. We understand that ultimately your goal is to be pain-free, but that will be a process. We'd like you to think about activities that your pain and decreased mobility are preventing you from doing. Many patients say they'd like to return to walking for fun, or that they want to walk on the beach or dance at their daughter's wedding. As you work to meet small therapy and activity goals, your bigger life goals will become closer to reality. It's important to keep your mindset on success. When you're in pain, it's easy to tell yourself that you can't do it, but we know you can. Your surgeon has chosen you as an appropriate candidate for this surgery, and through hard work and dedication, you can be successful. Try to keep that in mind as you progress through this process. You'll also want to prepare your employer. If you or someone caring for you will be taking time off work, you'll likely need to complete medical leave papers. Please know that these papers come from your employer, and each employer has different requirements. Most employers require your surgeon to complete a portion. Please make sure to submit these to the clinic at least 2 full weeks before your surgery so they can be completed in time. There is a $25 fee associated with completing medical leave papers. It's very important that you prepare your finances as well. While the hospital and clinic will verify pre-authorization through your insurance, you need to be aware of possible out-of-pocket costs. Those costs may include medication copays, walker copays, dietary supplements such as Gatorade and Ensure, and insurance deductibles. Please have a conversation with your insurance provider before surgery so that you fully understand your possible out-of-pocket costs. About a week before your surgery, the social worker will call you to complete a preoperative assessment of your postoperative needs. They'll discuss your current home situation, your discharge needs and plans. They'll identify your support person or team, and they'll review this joint class education with you. The social worker will also ask if you set up your postoperative physical therapy. It's important that you complete this as soon as possible before surgery. When considering where to go for therapy after surgery, please keep in mind a few key points. First, you can go anywhere you'd like. You should start outpatient therapy 2 to 3 days after surgery, and we'll send an order with you to take to your first therapy session. Please plan ahead for transportation because you won't be permitted to drive for several weeks after surgery. You'll be given instructions about when to obtain your COVID test. Please make sure that you complete your test on the date scheduled. It's important that after your test, you self-quarantine at home until you arrive at the hospital for your surgery. Please notify your primary care physician, then us, if you develop any signs or symptoms of COVID-19, such as fever, chills, sore throat, shortness of breath, or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, nausea, vomiting, or diarrhea. Because this list is not complete, please notify your doctor if you develop any new or unusual symptoms. The business day before surgery, you'll need to call your surgeon's office between 10 and 11 a.m. to find out your arrival time. The phone number to call is 304-691-1262. Please tell the receptionist your name, that you are calling for your surgery time, and the name of your surgeon. If your surgery is on a Monday or a holiday, please call us the Friday before to get your arrival time. The night before your surgery, please double check your arrival time, review your medications, and don't eat anything after midnight. This includes avoiding gum, candy, and chewing tobacco after midnight. The morning of surgery, remember not to eat, but please brush your teeth, making sure to spit the water out. You can swallow clear water, not coffee or soda, just clear water, until 2 hours before your arrival time. So, for example, if you're instructed to be at the hospital at 7 a.m., you can have clear water until 5 a.m. Also, please make sure to take all medications as instructed by Dr. Wallace before you come in. Please double check that list to make sure you are taking the correct medications. When preparing to come to the hospital, please make sure you bring a few essential items. It's important that you bring a list of current medications and that you're able to tell us the last date and time that you took each one. Please also bring loose-fitting clothing that will be comfortable to wear around while walking and working with therapy. Feel free to bring an outfit for sleeping as well. Make sure you also bring shoes for walking and doing therapy. It's important that they have a non-skid sole. Please keep in mind that the staff can help you put your shoes on, take them off, and tie them as needed. If you have a walker, please bring that. We prefer a standard front-wheeled walker, as you can see in this picture, but if you don't already have a walker, we can have one delivered to you before you go home. Please don't bring large sums of money or valuables. When you arrive in the morning of surgery, please enter Cabell Huntington Hospital through the Marshall Medical Center entrance located near the front entrance next to the pharmacy. We ask that you wear a mask while in the building, and please make sure you're familiar with the current visitation policy before your arrival. After entering, please follow the signs and make your way to the elevator. Take the elevator to the second floor. Please remember that when you arrive for surgery, you need to be healthy and your skin has to be intact. You've got to make sure that you don't have a cold, fever, or sore throat, no open or scabbed wounds, no rashes, no infected or ingrown toenails, and no inflamed gums or cavities. I can't stress enough that your skin has to be intact. When you arrive the morning of surgery, the nurse in the pre-op area will complete a full skin check to ensure that you don't have any cuts, scratches, scabs, sores, wounds, or rashes anywhere. It's so important to make sure that your skin is intact when you arrive for surgery because any bacteria present in your body at the time of surgery increases the opportunity of that new implant becoming infected. Bacteria love metal, and any bacteria that are present could potentially gravitate to your new joint, which can lead to a devastating infection. If your joint becomes infected at any time, whether it be 10 days or 10 years after surgery, it could be life-altering. It could lead to multiple surgeries, extended periods of time in the hospital, lengthy antibiotic courses, and changes in the way you walk and use your leg. Preventing infection is at the top of our priority list. Your surgeon knows that your skin is your first and your best line of defense against infection. So when you come in the morning of surgery, it's very important that you ensure your skin is intact. And during the skin check, the nurse will make sure that you don't have any animal scratches, insect bites, stings, scabs, pimples, or rashes anywhere. To make sure there are no unwanted surprises the morning of surgery, please inspect your skin several times between now and the time of surgery. Look closely. Look especially close on your operative leg and even in the areas that most of us don't usually look. If you'd like a nurse to assist you with your skin check before surgery, or if you find something that you may be concerned about, please contact your surgeon's nurse at 304-691-1262. On to the operative phase, arrival at the hospital. Remember to check in at the surgery desk located on the second floor of the hospital. The staff will then bring you to the pre-op area and assist you with changing into a hospital gown and completing the nose-to-toes routine, a program designed to further help reduce your risk of infection. After that, the nurse will review your history and medications. They will ask about your current and acceptable pain levels and start an IV in your arm. Additionally, you'll be asked to sign the required paperwork, including the consents for surgery and anesthesia. Please feel free to ask any questions that you may have during and after consent review and before you sign to any member of your team, including the surgeon, surgeon representative, anesthesiologist, nurse, or mid-level practitioner. The appropriate surgical site will be verified and marked, and we will complete a skin check and mark the location of pulses on your feet and ankles. We will also apply a surgical stocking to your non-operative leg. One will be applied to your operative leg after surgery. During this preoperative period, you will meet your anesthesiologist. They will discuss the type of anesthesia you can expect, but come in knowing that for this surgery, our surgeons use a spinal with sedation. The thought of a spinal can sometimes cause anxiety for people, and this is understandable. The anesthesia team will administer a medication before they begin to help you relax while the spinal is being placed. Then it's time for the operating room. Your surgery will take about an hour and a half. You'll be back in the surgical suite for longer than that due to the preparation, but the surgery itself typically lasts only for about 1.5 hours. Now, let's talk about your surgical site. First, location. For total knee replacement, your incision will be across the front of your knee, and the length is typically anywhere from 6 to 8 inches long. For a total hip replacement, the location of your incision depends on the approach your surgeon is using for your surgery. If you're having a posterior approach total hip replacement, the surgeon will make the hip incision toward the back of your hip, closer toward the buttocks. If you're having an anterior approach total hip replacement, the surgeon will make the incision at the front of the hip, which typically starts at the top of the pelvic bone and extends down toward the top of the thigh. And now for skin closure. Most patients are able to have their skin closed with a special surgical tape, which we call dermatape. The use of dermatape provides a waterproof barrier and allows patients to shower quickly. For various reasons, sometimes the surgeon chooses to close incisions with a different closure type, including staples or sutures. Regardless of your skin closure type, you will have full range of motion of your joint after surgery, and you will be permitted to shower in the specified time frame, and your rehab after surgery will be the same. On to the postoperative phase. What happens after surgery? When you leave the operating room, you'll be transferred to the post-anesthesia care unit, or PACU. Many people still refer to this as the recovery room. You'll notice that you'll be wearing oxygen and a monitor. You'll hear the heart and blood pressure monitors beeping, and you'll be receiving IV fluids. Most people remain in PACU for 3 to 5 hours while the spinal wears off and they fully recover from anesthesia. Here, you'll begin your post-operative portion of preventing your own complications. To do this, you're going to begin doing ankle pumps at least 10 times every hour by simply flexing and extending both feet and ankles. Ankle pumps can promote circulation and potentially reduce your risk of blood clots from forming. You'll also be wearing TED hose on both legs. TED hose are surgical stockings designed to promote circulation after surgery and further reduce your risk of blood clots. You'll wear TED hose for 23 hours a day for 5 weeks. Other devices you'll be wearing are foot pumps or SCDs, which are mechanical devices only worn while in the hospital and only while in bed, also used to prevent blood clots. Deep breathing exercises can help reduce your risk of pneumonia. Pneumonia can be caused from slowed or shallow breathing secondary to anesthesia, narcotic pain use, pre-existing conditions such as COPD or emphysema, and decreased mobility. You will receive an incentive spirometer machine, like the one seen here, and the respiratory therapist will teach you how to use it properly. In the meantime, you should complete deep breathing exercises on your own. To do this, take a slow, deep breath in through your nose and hold it for 10 to 15 seconds, then exhale. This may cause you to cough. That's good. We want to get those secretions up and out of your lungs. Complete deep breathing exercises at least 10 times every hour while awake. We encourage early activity or walking as soon as possible after surgery to decrease your risk of complications such as blood clots and pneumonia. The therapist will assist you with walking the first time, often as early as while you're in the post-anesthesia care unit. After that, we encourage several short walks over the course of the day and evening with the nursing staff. Please don't get up by yourself because you'll be a high risk for falls while in the hospital. Now, pain. It's important to come into this process with a realistic expectation of pain. The nurses, therapists, and doctors will routinely ask you to rate your pain on a scale from 0 to 10. Our goal is to manage your pain while you're in the hospital, not to relieve it. Most people have pain for about 6 to 8 weeks after surgery, though the first week or so is typically the worst. Your surgeon will instill a light numbing medication into your joint during surgery to help with the pain. The nurses will also give you medications to assist with the pain around the clock. If those medications are not effective at managing your pain, please let a staff member know. While the benefits of pain medication can be useful, narcotic pain medications are known to have side effects. Some common side effects include slowed breathing, potentially leading to pneumonia, drowsiness or sedation, putting you at a higher risk for falls, dizziness, nausea and vomiting, and constipation. There are many alternatives to pain medication. When used alone or in combination with your medication, they can improve pain management and reduce potential medication side effects. Some alternatives include ice, repositioning, sitting or walking, music, guided imagery, or meditation. In addition to pain, it's not uncommon for patients to experience some level of nausea. You will receive medication to reduce your risk of nausea before, during, and after surgery. But please let your nurses know if this is not effective. We do suggest that, to reduce your risk of nausea, you try eating small cracker or something starchy when taking pills for the first few days after surgery. And also know that constipation is common after surgery. Constipation can lead to increased nausea and pain, but can be avoided with medications, plenty of fluids, and potentially even by chewing gum. Remember, you can do this. The pain will get better, but you've got to keep moving to help with the pain. While you're in the hospital, the nurses are going to give you pain medication around the clock. But if you don't want it, or even if it's not enough, please alert the nurses, the staff, or the doctors. Keep calm. You're in charge. On to the rehab phase, beginning your rehabilitation after surgery. After you've completed your recovery in PACU, you'll be transferred to the Joint Replacement Center. The phone number to the Joint Center is 304-399-1567 and can be given to your family as you decide. All of the rooms on the Joint Center are private rooms, and you're welcome to have family visit in accordance with the current visitation policies. You'll need to continue your deep breathing exercises using the incentive spirometer machine and your ankle pumps at least 10 times every hour while awake. You'll be given a liquid diet to start, and that will be increased as tolerated. Please don't eat solid food too quickly, as anesthesics can slow your gut, and large meals right away after surgery can lead to nausea and vomiting. Keep in mind that your surgeon wants you out of bed more than you're in bed right away. You'll be full weight bearing, meaning you can put all of your weight on your brand new joint. And if not started already, the physical therapist will assist you with transfers in and out of bed, in and out of the chair, and walking shortly after your arrival to the Joint Replacement Center. As the day of surgery progresses, it will be important that you empty your bladder, and the nurses will be monitoring the amount that you void. Please do not get up by yourself, as you will still be a high risk for falls throughout your hospitalization. Rather, Let the staff know when you need assistance to the restroom. Also, let the staff know if your pain is not managed, as they can assist with non-medication interventions to pain or pain medication. It's important that you rest the night of surgery, but keep in mind that it's not uncommon for people to have difficulty sleeping that first night. The morning after surgery, you'll be expected to be dressed and up in the chair for breakfast. Please keep in mind that you're in charge, so please let the staff know when you want to get up and down. You'll have routine lab work completed, and therapy will work with you. All patients will receive physical therapy the morning after surgery. Patients will work on transfers, walking, and maneuvering up and down stairs. The therapist will review your home exercise program to ensure you understand how to do the exercises at home on your own. Please complete these exercises 3 times a day, 7 days a week at home. If you've had a knee replacement, the physical therapist will measure your range of motion, or range in which your knee will straighten and bend, while in the hospital. The knee has a typical range of motion which goes from 0 degrees in full extension to 140 or 150 degrees in full flexion. Starting with your first measurement, it's expected that your range of motion is 5 to 90 degrees or better, with most patients well exceeding that goal. It's very important to know your range of motion with each therapy session and continue to improve. By the time patients follow up at their 2-week appointment, most patients are achieving a range of motion of about 0 to 110 degrees. If you've had a hip replacement, you must protect it by avoiding certain positions and movements. By adhering to these precautions, you will allow your new hip to heal and also prevent it from dislocating. The surgical approach to your hip replacement will be determined by your surgeon. If your surgeon performs an anterior approach total hip replacement, your therapist will review anterior hip precautions as suggested by your surgeon. Anterior precautions may include avoiding excessive external rotation or rolling your leg out to the side. If you have a total hip replacement from the posterior approach, your surgeon will ask you to follow posterior hip precautions. First, you must avoid internal rotation or rolling your operative leg inward. This would include activities such as reaching over to pull up your sock, rolling over in bed, or rolling your leg in while walking. Next, avoid bending your hip or flexing past 90 degrees. This would include activities such as bending over to pick up a fork or tying your shoe. Next, avoid hip adduction or crossing your legs. This would include activities such as crossing your knees or ankles when sitting or sleeping on your side without a pillow between your knees. If you've had a hip replacement, an occupational therapist will evaluate your ability to safely complete your activities of daily living. The OT will ensure proper bed mobility and transfer techniques and will provide any adaptive equipment needed to promote independence following your surgery. One of the most effective ways to avoid complications after hip or knee replacement surgery is early mobility. That's why it's very important that you are out of bed, into the bedside chair, and up and walking early and frequently. The more you're out of bed, the better, while you're in the hospital and at home. But everyone is at an increased risk for falls due to the surgery itself, increased time in bed, medications, and unfamiliar environment. But you can help prevent falls by doing things like using your call light. Please don't get out of bed by yourself or up and down from the chair or off the toilet by yourself. Use assistive devices as instructed, such as your walker. You'll want to change positions slowly and move about carefully. Always wear shoes with non-skid soles, and please notify a staff member if you feel dizzy or weak. As you progress through this process, discharge planning will continue. The social worker will come to your room and review your discharge plans. Keep in mind that the vast majority of patients are discharged home, even if they live alone. You will have completed the social work assessment before surgery, and you will have your support system in place for discharge. The social worker will review any equipment needs that you may have and work with you to obtain a walker if needed. We do not discharge patients with wheelchairs or hospital beds, as this surgery is designed to help you gain independence from such equipment. Finally, the social worker will verify that you have successfully set up your outpatient physical therapy. The therapist will make sure that you've met your therapy goals and review your home exercise program. The physicians, including your perioperative team and surgical representatives, will ensure that you're medically stable and ready to transition home. They will discuss your medications, treatments, and follow-up care. Please feel free to ask any questions you may have. And then you'll be discharged home. Keep in mind that you won't be permitted to drive for 4 to 6 weeks after surgery, depending on various factors. That means that you'll need to arrange to have someone to drive you home the day after surgery, typically in the early afternoon, and twice a week to therapy and to your follow-up appointments. You'll be sent home with a few new medications to take temporarily. Cabell Huntington Hospital has partnered with Marshall Pharmacy to make it more convenient for you to obtain new prescriptions. If you choose to participate, the Meds to Beds program is available to deliver medications to your hospital room before you go home. Please know that using this program is completely voluntary, and if you choose to use it, you do still have to pay your medication copay just as you would at any pharmacy. The new medications you will go home with include several different pain pills, both narcotic and non-narcotic, a stool softener, and a blood thinner. The perioperative team will review these medications with you before discharge. It's very important that you take them as instructed. If you have any questions about how to take your medications, please contact your surgeon's office right away. The prescriptions you'll be given for pain medication are designed to last you through the worst of your pain. Remember that most patients have pain for 6 to 8 weeks after surgery, and our goal with pain medication is not to make you pain-free. That is a process that requires time, exercise, medication, and other pain-relieving modalities such as ice and repositioning. Narcotic pain medication should be used sparingly, and you should wean yourself off in the weeks following surgery. West Virginia law requires the use of a pain contract. Please review that before surgery and discuss any concerns with your surgeon before signing. The blood thinning medication prescribed to you is especially important to reduce your risk of blood clots after surgery. Because joint replacement is a major orthopedic surgery, you have an increased risk of developing blood clots in your legs or lungs. Some people are at an even higher risk based on their medical history, age, and medications they take. Most patients are discharged home with a prescription for aspirin as the medication to help prevent blood clots, but this will be individualized based on your medical history. It is important to remember that aspirin after surgery is not used for pain, and it must be taken twice daily exactly as prescribed. If your physician determines that you need a different blood thinning medication, this will also be discussed with you at length. Regardless of which blood thinner you take, please keep in mind that you may take longer to stop bleeding and must hold pressure if you get a cut or scrape. If you fall, notice any unusual bleeding, or experience any shortness of breath, please go to the nearest emergency room and notify the staff that you are taking a blood thinning medication. In addition to the medication you'll take to prevent blood clots, it's very important that you actively participate in reducing your own complications. To further reduce your risk of blood clots, your doctor will ask that you wear thromboembolic deterrent hose, also known as TED stockings, for 5 weeks after surgery. You should wear these for 23 hours each day, removing them once daily to check your skin and circulation. You also need to stay mobile and move about often. Remember that you should be out of bed more than you're in bed. Complete your therapy and exercises as instructed, both at home and with your therapist. And continue your ankle pumps and deep breathing exercises at least 10 times each hour while awake. You may be tempted to spend time in your recliner when you go home. Unfortunately, a recliner presents multiple potential hazards following hip or knee replacement. Your recliner can lead to dislocation of your new hip replacement or contractures of your new knee. It can lead to pressure on large vessels, resulting in blood clots and lengthy inactive time. As much as many of us love our recliners, they should be avoided in the weeks following surgery. Caring for your incision at home is very important to promote healing and prevent infection. While individual instructions will be given before discharge, in general, it is important that you keep the incision and surrounding area clean and dry. Do not apply creams, ointments, or powders. No soaps, alcohol, or peroxide. Most patients will be permitted to shower within a few days of surgery, but do not soak or submerge your incision for at least 3 full weeks. Your surgeon will give you individualized instructions based on the progress of your incision healing. Keep in mind that bruising, numbness around the incision, and mild to moderate swelling are all normal after surgery. But please contact the office if you have any sudden change in drainage or redness, any increased pain or swelling, or any pulling apart of the incision, or if you have a fever for more than a week. Now, let's talk about care of your joint in the future. It's important that you pay attention to your body in the first few days and weeks after surgery, but also for the rest of your life. Signs and symptoms of infection could include redness, swelling, new drainage, unhealing wounds, new or persistent fever, or a change in function of a joint that had been working well. At the first sign of infection anywhere for the rest of your life, it's important that you contact your doctor right away. And to prevent infections after discharge, make sure that you go home to a clean and safe environment. Care for your incision as instructed. Take your medications as instructed, including your long-term medications for your chronic health conditions, and follow your physician's directions. Also, you'll need to pre-medicate with antibiotics before having any invasive procedure for the rest of your life. This includes dental cleanings, skin procedures, and colonoscopies with biopsies. Keep in mind that the antibiotic will come from the doctor doing the procedure and is usually recommended for 1 dose 1 hour in advance of the procedure. Please have a conversation with the doctor well before having any procedure done and remind them that you have a joint replacement. After your new joint replacement, you may set off metal detectors in airports, federal buildings, schools, and other secure areas. After 9/11, Homeland Security no longer accepts physician notes or cards as proof of surgery. Therefore, when you approach a metal detector, simply inform the technician that you've had a hip or knee replacement. Care of your joint replacement is a lifetime commitment. To ensure you continue to minimize your risks and complications, it's imperative that you maintain a healthy weight and active lifestyle, maintain good control of chronic medical conditions such as diabetes, high blood pressure, or lung disease. Ensure your environment is safe and that you maintain a support person or system, and continue to avoid tobacco, recreational drugs, and alcohol. Please also keep all of your scheduled follow-up appointments. Your surgeon will schedule you to be seen in the office at 2 weeks after surgery, 6 weeks, 3 months, 6 months, and 12 months after surgery, and then yearly. But we also must speak to you by phone within the first week after surgery, at weeks 3, 4, and 5 after surgery, even if you're doing well. If we call and leave a message, please call us back right away. Our program has a 24-hour answering service where you can access care 24 hours a day, 7 days a week. The phone number is the same as your surgeon's main number, 304-691-1262. If you call after business hours, the physician will call you back to address your concerns. But if you're having an emergency, please do not wait for a return phone call. Please proceed to the nearest emergency room. Please seek emergency care if you have a sudden, significant change in your wound, pain, or drainage. If you have a very sudden or very high fever or any shortness of breath, or if you just believe you're having an emergency. In the back of your joint class book is a tab called Community Resources. Feel free to utilize any of these resources to assist you with your recovery and ongoing health maintenance. Also included in your joint class book is a list of online resources. Feel free to access any additional information regarding your treatment options, surgery, and recovery. As you move closer to your surgery date, please remember that you are the most important player on your team of caregivers. The doctors, nurses, and therapists play their role in supporting your care, but only you can do what needs to be done to make your new joint its best. Think of your recovery period as you would your job and put your best effort forward so that you can have the best outcome possible. Keep in mind that while pathways are standardized, we recognize that every patient is different. You'll receive individualized care as determined by you, your family, your doctors, your therapists, and nurses. As we prepare for your surgery, we must be able to reach you by phone. Please check your messages and please ensure that we have your most current phone numbers on file. Again, the program manager's name is Shakara Pauly. If you have additional questions, she can be reached during business hours at 304-526-2607. Or you can contact your surgeon staff at 304-691-1262. These phone numbers can also be found on page 3 in your joint class book. This is a big surgery with a lot of expectations and processes, but you've come to the right place. Our patients come in all ages, shapes, and medical conditions and have great success. You're well prepared and ready to tackle this surgery so that you can get back to doing what you want to do. Thank you for choosing Cabell Huntington Hospital and Marshall Orthopedics for your joint replacement. Please call if you have any questions, and we look forward to seeing you again soon.